So, autism is a neurodevelopmental disorder characterized by troubles with social interaction, communication, and certain behaviors. This is a neurodevelopmental disorder that can be diagnosed in a child as young as 2 or 3 years of age. So, with autism or the autism spectrum, you have first, the child has, clear difficulties with any form of social interaction. So, say even at perhaps 5 and 6 months of age, when a baby is supposed to have, say, what we call as a milestone of a social smile, that may be missing. Then as they grow older, the need to play, the need to interact, the need to make friends, maintain eye contact, and just want to be around peers and have social interactions seems to be lacking. The other aspect clearly is when a child is even 1.5, 2 years of age and has delayed speech and language skills and communication abilities. So sometimes kids are completely non-verbal, where they're even 7 or 8 years of age and they don't have any speech and language skills. And even with speech and language, there are two types, right? There is receptive language skills, which are ongoing and developing in autistic children, but expressive language skills and expressing their emotions and feelings and even words sometimes is not developed in these children. And then thirdly are the signs and symptoms of certain behaviors. So children with autism, the physicality of it is that sometimes they have stimming, they have rocking, they rock their body to and fro because of certain sensory problems. They don't like to be sometimes touched, they don't like to be held, they don't like any physical contact. Sometimes there are a lot of occupational therapy needs or sensory needs in children with autism. They also sometimes have low sitting tolerance and poor attention spans, concentration levels, and focus. So these are some of the kind of signs and symptoms of what conglomerates the autism spectrum. When you look at autism, it can be very, very mild. So what we used to term as Asperger's disorder, and it can be even severe. So the spectrum means you can have all these autistic signs and symptoms in a child who is very, very high functioning. So such children have, say, a very average or very above average intellectual potential, and they are bright kids, but then they have all these social and communication problems which are mild in nature. Such children integrate better or well into normal mainstream schools and perhaps even take up jobs and are successful in life. But that's the high end of the spectrum. On the lower end of the spectrum, you can have severe autism with intellectual impairments or a very, very low or not normal IQ level as well, wherein there may be no speech and language, delayed milestones, and a very low IQ with more severe behaviors and more severe problems with communication, eye contact, and social skills. I don't think we can cure a neurodevelopmental disorder or cure a learning disorder or cure autism really. Those are maybe wrong terms to use. But it's not like curing a cold or a cough or a fever, because these are long-standing neurodevelopmental problems where certain learning pathways or neurophysiological imbalances exist in the brain. And can it get better? Yes, but early intervention is key. So the earlier you intervene with any neurodevelopmental disorder, the earlier you start treatment, you will definitely have far better outcomes. But again, it depends on where the child is on that spectrum. So they've been trying to find a specific gene related to autism, but it's all under research and still studied. But yes, when you look at the positive factors of any neurodevelopmental disorder, we look at neurophysiological aspects, we look at the neurodevelopmental aspects, we do know that certain pathways in the brain haven't been formulated properly. There are certain anatomical changes in the brain also that lead to certain neurodevelopmental disorders, and there are genetic factors also as well that play its part. But there is no particular one reason as to what causes autism. I mean, in a few months, I mean, a few years back, there was some talks about certain vaccines in children and mercury poisoning also leading to certain autism traits, etc. But I think all those are not, there's no real evidence behind what causes autism. So we don't know why there is a surge and an increase in the diagnostics. I think one is because I think there is more awareness as well. Yes, there are far more cases of autism that we are seeing in our practice today, but there is no real cause again that has been identified as to why so many more kids are being diagnosed with autism. But I think the key in this is also far more awareness. So even us as medical practitioners, we are now far more aware and more cognizant of what the autistic traits are and what the autistic symptoms are. So I think more schools are picking it up, more teachers are aware, more parents are aware, and I think that whole awareness also is bringing to light more diagnostics of this spectrum. Like I mentioned, you can be 5 and 6 months of age and not have a social smile. You can have a child even under 1 or under 2 years of age and there is no eye contact. You can have a child who's reached 3 years of age and not had any speech and language development. You can have a child who's 5 and 6 years of age and still has the social skills or social behaviors of a 2-year-old. So there is no specific month or age or year when these symptoms arise or go, but we do know that there are these developmental delays, primarily in areas of speech, language and communication, in social skills, and thirdly in behavior. So these are the three main aspects of milestones which are compromised on. What we do need to do is that every time we do know that there is a specific delay in development, again, autism needs very, very early intervention. So when you look at or you speak about how to help a child who's even as young as 2 or 3 years of age with the diagnosis of autism, there is a triad or 3-prong approach to autism. One is with early intervention, where you have to engage the child with occupation therapy, because occupation therapy works on improving the child's sensory profile. It improves the child's sitting tolerance, engagement, social skills, hand-eye coordination, fine motor skill development, and all the other skills that go into pre-reading and pre-writing skills is what OT and occupation therapy can help with. The second mode of intervention is definitely speech and language therapy that helps with communication, language development, or the articulation of speech, and basically bridges the gaps of the speech and language development areas as well. And the third intervention is a special educator, again working on a remedial program to enhance the child's academic skills of reading, writing, or math abilities. And also sometimes what helps children with autism is assisted behavior therapy or behavior therapy approaches through play therapy, etc. that again helps with improving the child's social skills, social engagement and communication abilities. The biggest myth, if at all, is that autism is mental retardation, which is not true. Because some of the autistic kids that we have grown to know with are some of the most bright and intelligent kids that we know, where their IQs are normal, but let's say their intellect is compartmentalized. So for example, there's one autistic kid who's in our school. If I tell him that on the 26th of August, in 3 years from now, which day will it fall on, and he'll give me the bang on correct answer. So sometimes there is also giftedness in autism, where they have some amazing skills which they just have innately within them for places, for numbers, for art, for for memory skills, or with calendar aspects. So there are a lot of amazing things that certain autistic children can develop in.